Welcome to Mayo Clinic Q&A. I'm Dr. Sanj Kakar. Emergency medicine is a specialty that prides itself on a mantra of anyone, anything, and anytime. The COVID-19 pandemic has put emergency healthcare providers and first responders on the front lines fighting the spread of the virus. Joining us to discuss emergency medicine during COVID-19 is Mayo Clinic Professor of Emergency Medicine, Dr. Annie Sadosty. Welcome to the program, Dr. Sadosty.
Thank you, Dr. Kakar.
How are you? How have you been?
Very good, very good.
I see you're suitably attired today. How's your traditional day going?
You know, the important stuff is functionally the same. We have great colleagues and wonderful multidisciplinary teams who are doing what we do, being available any time of day for patients who need us. So the important stuff is the same. There are some differences, obviously, in light of the pandemic, and it can be a little eerie, actually, in the emergency department. We're seeing large number of patients with symptoms that could be COVID-19, and trying to identify COVID among those patients is a new challenge for us, given that it's a novel virus. And there are some challenges associated with doing so with regard to the way that we have to protect ourselves and the patients from the infectious illness. So there are some differences, but the important stuff remains the same.
So as you said, there are some differences, and this is not the typical flu that you see in the winter season. How have you seen that the symptoms are different when patients have coronavirus?
Well, I've often said that it is a little bit like finding a needle in a haystack, at least early on. So influenza and COVID-19 or coronavirus really have a lot of overlapping symptoms. So fever, cough, shortness of breath, sore throat, those can all be present in influenza and COVID-19. So it's been a bit of a challenge as we've been evaluating patients during flu season with possible COVID-19. So differentiating the two has been somewhat challenging. The test has helped a lot, and we're very grateful for that. But that's not always available to us in the emergency department. And so we're trying to go based on symptoms and doing the best we can.
So you said that your workflow has changed compared to typical days. Can you explain that a little bit more in terms of how that's happened?
Sure. First of all, I think that emergency departments across the country and at Mayo Clinic in Rochester have seen lower volumes overall. And I think that's because the social distancing has cut down on influenza, A, interestingly. B, fewer people are out and about, and so we're seeing fewer patients with motor vehicle crashes or fewer patients with injuries related to activity. So our volumes are down, but what we're seeing is more people with what could be COVID-19's fever, cough, shortness of breath, fatigue, sore throat, anosmia, which is not smelling. It's the new part of the potential syndrome. So our specialty has changed a little bit. A lot of us will remark on how it's been a while. I haven't seen a patient with a motor vehicle crash in probably 5 shifts, which is crazy, but there just aren't many cars on the road. So that's a big difference. And I worry that patients who need us aren't coming to see us. And we have seen a little bit of that, people who waited and waited at home suffering and then came to see us at a very late stage of disease. And that's heartbreaking also, because we are here for everyone, patients with and without COVID. And I sure hope that patients access our expertise when they need it.
I'm glad you raised that point, because as you said, in the mantra of anyone, anything, and any time, and the messaging has been, don't come to the emergency room. And as you said, there may be patients, for example, with abdominal pain or having a heart attack. and they've been hearing don't come to the emergency room. So what's your message to those people?
My message is we are here 24/7, 365 for patients who need us. And I would say that if you think you have an emergency, evaluate in your head whether you should call 911 or not, but don't avoid the emergency department because it may very well be the best place for you. If you think that you might have COVID, but otherwise are feeling okay, there are other places to get tested, and I would say that you should use those venues for testing. Call your primary care doctor or primary care provider, nurse practitioner, or PA to discuss the testing options. Don't come to the emergency department purely for a test.
Yeah, that's great advice. Tell me how the morale has been amongst the team, physicians, allied staff, nurses, even the janitorial staff. Tell us how the morale has been that you've seen in the department.
You know, we're holding up. There are aspects of this that have been really beautiful. I think that um, challenges and crises really teams rise to the occasion, and that's definitely playing out day after day after day in the emergency department. I take a little extra time to thank the janitorial staff because they are really doubling down on cleaning and sanitation. And while they do that every day in a phenomenal way,
Mm-hmm.
they're unsung heroes in this, and their work has been highlighted as being extraordinarily important, which of course it is every day, but it gives us a chance to really highlight their work. The multidisciplinary teams, the work is hard. The protective garb that we wear, the gowns, the masks, the face shields are uncomfortable. Let's just be honest. And you sweat every time you're in it, in a patient room. And so people are maintaining positive attitudes through things that are a little inconveniencing and different. And we're supporting one another through it, which I think is a marker of a good team. And then people outside of the emergency department have been extraordinary. It has happened innumerable times where I have gone into a room to take care of a patient who's feeling lousy. Mm-hmm. And they thank me for being there, which emergency medicine is a specialty where thanks don't, they're not a part of our day-to-day, frankly, because patients are sick and often aren't in a position where they can thank the team. But this is a little different. I think they're seeing on the news some of the heroism that's happening all over the world. And it's really humbling when the patients are thanking us. So the community also, I mean, you've seen signs in the community thanking the healthcare heroes. We've had more food delivered to the emergency department. It's from all over. I mean, the restaurants in the community have sent pizzas and gift cards. People have volunteered to make head cover, like surgical bonnets for us to protect our hair. The community has come together, both medical and the town and surrounding towns. So even when there is a somber overtone, because it isn't lost on us that there is risk associated with the work that we do, there is also beauty in it.
Yeah, it's something that people don't often talk about, but it's the human touch of medicine, as you said, is an art form. And tell us about you, Dr. Sadosty. You're a professor of emergency medicine, and as you said, you're an expert in emergency medicine. But now, obviously, there's the human side to it. Patients are scared. How have you adapted to that role? How are you coping? You mentioned about the equipment that you wear to work, and then you go home. How are you sort of decontaminating yourself, as it were, when you go home, so you don't subject your loved ones?
I'll try to be sure that there's not too much information here, but there, I think that a lot of us have developed a new process about trying to protect our families
Mhm.
from what could be an infectious disease that we acquire through work. Now, we're being very careful at work with exquisite hand sanitization and the protective garb. But I will tell you that I wear a pair of scrubs at work, and I change out of those scrubs at work and then wear a different pair of scrubs home so that my car doesn't get contaminated with the
Mm.
germs that might be on my scrubs. And then when I arrive home, I take off the scrubs that I have, that I wore in the car, and I empty the ones that I wore at work and the ones that I had been wearing in the car into the laundry machine. And then I scurry upstairs to shower without saying hello to any member of my family. And then I shower at any time of day, and sometimes that's 2 a.m. I'm taking a shower in order to not contaminate my house and to protect the people I love at home. So that routine, if you will, is playing out in house after house after house of the emergency workers, EMS, nurses, physicians, nurse practitioners, PAs, and I'm sure radiology techs and all of the people lab techs who make up the team that does emergency care. And we're doing what we can because we don't want to infect our loved ones if we end up being some of the asymptomatic carriers. We're also checking our temperature 2 times a day and being very mindful of if we don't feel well, not working, which is a little counter to the historic behaviors. It takes a lot to have an emergency worker not work, because if we don't work, someone else has to work for us. We don't, we need the workers, but if anyone is sick, they're out, and there are layers of a backup team now available so that if someone has a sore throat, which normally wouldn't take us out of commission, we're calling in sick so that we don't infect our patients. And then people are out as they wait for the test or out on social isolation / quarantine. And we're supporting them as they're out, because we have had colleagues out, and that's hard. It's very hard.
Yeah, how have you found, as you said about it is hard, and this is a new norm right now, in terms of the morale amongst the residents, the fellows, the nurses, how have you found them as they go through this pandemic?
You know, the teams have been extraordinary. We have residents from all services in the emergency department, and I have been completely awestruck by their bravery, their desire and willingness to garb up with us and go right in to the rooms. Sometimes the off services are perhaps a little bit unfamiliar with the garbing technique, and so we spend extra time being absolutely sure that they're safe and confident in their protection. But I will tell you, the next generation, if you will, has completely stepped up, and as you'd expect them to do, but it is one of the beauties of academic medicine, is training the next generation of physicians and nurses and NPPAs. I mean, the teams have been really remarkable and selfless, which is really beautiful to watch.
Yeah, that's so heartwarming to hear. As you see, when you turn on the news, you see what's going on all across the world, and just to hear our unsung heroes being recognized recognize, and they don't want recognition. They just want to take care of patients. And as you said, the janitorial staff, they just do their job quietly and efficiently. And one day I had the pleasure of speaking to somebody, and I sort of said, "What are you doing?" And he said, "I'm saving lives." And he is. He is. They all are. They're all saving lives. So I really do appreciate you giving us another perspective from the emergency room. Anything else we should touch upon that we didn't, Annie?
Well, I think that we're all trying to flatten the curve, Dr. Kakkar. And for each of us, that comes in different flavors. But what is common for all of us is that we really need to adhere to social distancing. Hand hygiene is exquisitely important. So wash your hands. If you think you've washed them enough, you probably need to wash them 2 more times. And we will get through this. We will get through this, and know that the emergency department staff are here for you. And if you feel that you have an emergency, COVID related or not, don't hesitate to access the help that you need. We are here and we want to care for you. If you merely are concerned that you may have COVID-19 and think that you need testing, there are other venues that I would encourage you to access by calling your primary care provider, who can then direct you to the many different options, whether it's in a clinic, in a drive-through testing area, or otherwise. The emergency department is not a testing venue per se. It's here to take care of emergencies of all kinds. And we will always be here for our patients.
Well, I know you will, and all of your colleagues, and thank you for that. We've been discussing emergency medicine's role in the battle against COVID-19 pandemic. Thanks to Mayo Clinic Professor of Emergency Medicine, Dr. Annie Sadosty. Thank you very much for your time and efforts.
Thank you very much for having me. Stay safe, everyone.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.